So I don't think the controversy or the stigma will ever completely go away, but it is our hope that with each content piece we create, whether it be a video or a blog or a discussion forum piece, that people will begin to understand how and why medicine-assisted treatment can actually be a viable option to treat heroin addiction. Now, I understand that people have various opinions about this. I will see one comment that literally bashes medicine-assisted treatment, and I will see another post that claims that methadone or Suboxone saved their life. But I want to make a comment up front right away, and please listen, this is extremely important. I understand that we all have different opinions. Please share respectfully. One thing we will not tolerate, and we will remove these comments, and quite possibly, if it continues, the actual member of the site, if you try to tell somebody that they are not clean because you disagree with their chosen modality. I don't care if they're on methadone, Suboxone, the 12 steps, if they are involved in an IOP, cognitive behavioral therapy, or if they're standing on their head 16 times a day. If they're not using heroin or illegal substances and they are involved in a program with a proven success rate and it is being administered by a program or a medical professional of some kind, then they're clean. Look, we can debate whether somebody is utilizing the best of programs if you want, but realistically, medicine-assisted treatment is legitimate. It is treating a disease. When Alcoholics Anonymous was established in 1939 and created the policy of complete abstinence, addiction was not yet declared a disease, and medicine-assisted treatment like methadone and Suboxone and Naltrexone were not yet available, and they certainly were not widespread. So I get that complete abstinence is a very important principle, and I actually happen to agree with it. But here's the thing. How do you define complete abstinence? I don't consider medicine part of illegal drug use. So I consider people who are legitimately using medicine-assisted treatment as directed. I'm not talking about those people that abuse the program, and yes, I get it. People do abuse it, but not everybody does. I think people need to start trying to be a little less dogmatic and more understanding that there's not just this one mentality out there, that ultimately, yes, some people do abuse the programs, but not everybody does. So unfortunately, stigma and stereotype is created because of the few, and maybe even the many, people that abuse the program. I have ran into a number of people at methadone clinics and people on Suboxone who are coupling them up with benzodiazepines and abusing the program. Heck, some of them are even selling them. I mean, it's pretty bad, I'm not gonna lie. So no, those people are not clean. You can't say, I quit heroin, I'm clean, but I'm using Klonopin. Well, look, there is a exception to this. If you have a legitimate prescription for Klonopin for anxiety and are using it as directed by a physician, then yes, you are clean. And see, this is what I don't think people really understand. And I understand that I'm sharing an opinion here, and it's okay if you have a different one, just please share it respectfully. But I am a firm believer that medicine is medicine. So yes, I do understand that Percocet and Klonopin are prescription drugs and people abuse them. The difference is here that people who are using them as directed by a physician are not unclean. They are using legitimate medicine for a particular condition. I'm not saying that that medication is the best for you, and perhaps there are some alternatives, but using a medication as directed by a physician or a medical professional makes you clean. You're not unclean. Unclean is about drug abuse and addiction and whatnot. Now, I'm not saying everybody who has addiction is unclean, because addiction is a disease that lasts forever. There is no cure for it. So, but people who are living in active addiction, meaning that they are currently using and abusing their drug of choice, then they are not clean. But if you are in recovery, recovery and addiction has been put to sleep, dormant, or however you want to consider it, then you are clean if you aren't actively using. But I understand that it does get complicated. People tend to look at drug use and they say it's the same as addiction, and then other people say, well, wait a minute, if you're using one drug and you're clean, how can that person be considered unclean for using the same drug? I get it, it's confusing. Like Klonopin, a lot of people automatically think of abusing benzodiazepines when you think of Klonopin and somebody trying to get high. But there are people who are legitimately prescribed Klonopin for anxiety and use it as directed by a physician. So are they unclean? Do they suffer from addiction? No, they aren't unclean. They're clean. Now, whether or not they've become addicted to it, well, I think that would become evident if they begin abusing the drug. So, but using medication as directed, let's go back to the point looking at medicine-assisted treatment for heroin, methadone, and Suboxone. We can debate whether or not they are the best treatments out there until we're blue in the face. But I'm not going to tolerate somebody going on every post, and when somebody says, I am on methadone and I am clean and I haven't used heroin in 6 months and I feel really good about myself, and somebody gets on there and trash talks them, curses them out, and tells them how they are an unclean, what's the word I'm looking for, junkie, then that's inappropriate. And I will give you maybe one warning if you're lucky, if you decide to really try to trash talk somebody's recovery. This is a recovery community. We are very serious about encouraging and supporting people on their road to recovery, no matter what it is. Like it or not, medicine-assisted treatment exists. They are established programs, and they are here to stay. Hopefully something better will come along, and that's true for every modality. The 12 steps are great, but they're not perfect either. And all of the excellent treatment centers have a lot of great ideas, but they're still not cures. So each and every day, the experts in the field are working on trying to develop better and better treatments, whether they're holistic in nature, medicine related, or 12-step related. Ultimately, we're always trying to find better treatment options, and hopefully there will be more available in 5 years, 10 years down the road, hopefully even sooner. Let's face it, we need a change, and we need it now. There are too many people dying. And the reality is, while we can have a discussion, hopefully in a respectful way, the important thing is that we're all here for the same purpose. We're all here to help spread awareness about the heroin epidemic, to provide information about addiction and recovery, to provide encouragement and support for those people in recovery, and to help those suffering from addiction get the help and treatment they need. Why spend time getting super angry and debating and cursing each other off just because you disagree with their road to recovery? This is a waste of time, people. We need to unite. We need to stand together, and we need to stand strong. We need to fight this heroin epidemic, and we need to gather. We need to have events, awareness events. I think I'm actually even going to start trying to coordinate one locally in the Philadelphia area and see what we can do. Maybe we'll rally and perhaps do some goodwill. Maybe